at any time, feel free to do so. All right. Just a moment, sorry. Technical difficulties, I apologize. Sorry, Megan, my presenter view disappeared. Give me just a second.
No, we can see it. But you all are right. You're answering the question. Which trimester are you in? Go ahead and put in the chat. First, second, third. First is till about 12 weeks. Second is about 20 weeks. Sorry, 28 weeks. 28 weeks. And then the third is 28 to 40. So
there we go.
Right.
Back up and running. I'm sorry, I don't know what I did there. Yes, please share what trimester you're in. We're so excited.
A lot of third trimesters.
Yes.
First trimester with my first baby. Congratulations all. This is exciting. I have a newborn. Oh, fun.
Oh my goodness. That's so exciting, everyone. Yes.
Lovely. 7 days old. Woo.
Oh,
I hope you're holding them. Yeah, I just hope you're watching this holding your new baby.
Yes. We'd love to see it. Okay. And if everyone would also like to share how many you're expecting, if you're still expecting, but you can also share how many you gave birth to if you have some new little ones in your life.
One. Any twins, triplets? I have a new baby at home and expecting to get in the first trimester.
Irish twins.
Ooh, Irish twins. Yeah, that's what I was just going to say. Very exciting. First baby. Gosh, this might be a first baby shower. We don't have twins or more. Having a girl. Exciting.
So awesome.
Already have a 4-year-old boy. That's great. I bet he's so excited. Hopefully.
Yes. Those first couple of days with a new sibling can be a little tricky, but they're just, when they're cute together, they're just so cute.
So cute. Yeah. Awesome.
34 weeks. Wow. Okay.
Almost there.
Yes. All right.
So another set of Irish twins.
Ooh.
Keep it coming. This is awesome. All right.
So exciting. Well, we're so excited that you've joined us all today. We're going to be covering a lot of great information. So we'll get into our section, which is all about Count the Kicks, and talk to you about why we do the things that we do and why you're here today. So Count the Kicks is an evidence-based stillbirth prevention campaign. When I refer to stillbirth, what I'm talking about is the loss of a child from 20 weeks gestation on. So what we love about counting kicks and encouraging parents to count the kicks is that it can serve as an early warning system for anything that could be wrong. It educates expectant parents on the importance of tracking movement in the third trimester, and we make it accessible by having a free mobile app that anyone can download, and also paper charts online. So if you're going to be somewhere where you don't have access to Wi-Fi or technology, we've got you covered there as well. We just really want to empower parents to speak up if they have any concerns with their pregnancy, and this is one tool that can facilitate that. We know that 1 in 3 at-risk babies can be saved just by teaching expectant parents to use our app in the third trimester, and we have proof that that works because in the first 10 years of Count the Kicks being active in Iowa, where it was started, we actually lowered the stillbirth rate by 32% here for the general population and 39% for the African American population. So we know that it works and we know that it can save lives. So we're going to share with you a little bit more about how you can do that. So why do we care so much about movement? Movement is one very important way a baby communicates before birth. Um, when um, when a baby slows down with their movement or their movement weakens, that can be a nice early sign, and sometimes the only warning that we have that a baby might give while in distress. So a lot of times you'll see somewhat outdated information about if your baby slows down or they're not moving as much as you'd like, you can drink some cold water, turn on different positions, or eat a bunch of sugar. And really, we don't want to see that, because if you as an adult are sick and you know, drink a bunch of caffeine so that you can function in your life, that doesn't mean that you're not ill. It just means that you've done something to kind of kickstart things. And we don't want anything to get in the way of medical intervention on time. So it's best that if you noticed a change, to talk to your provider about it. So when we're talking about counting kicks, when we'd like to start counting kicks is between 26 to 28 weeks, depending on if you're considered high risk in your pregnancy. This is when research has established that there's a consistent pattern in the kicks, rolls, jabs that you're feeling. The only thing that we don't want you to count with Count the Kicks would be hiccups, because those are involuntary movements. So you'll kind of feel like a very rhythmic, gentle, like little taps. And that's more of like a hiccup rather than a movement. And we want to make sure that the baby is intentionally moving. All right. So here are a couple of common misconceptions that we hear about counting kicks. So if I were to say, well, Megan, my baby's always active, so I don't need to count kicks, what would you say?
I'd say that's great, Christine. A healthy baby is an active baby, but I still really want you to start counting your baby's movements in the third trimester, because sometimes babies can slow down without any other warning signs. So it's really important to understand what's normal for your baby, and it takes the guesswork out of knowing that. And we'll talk you through how to use the app here during the session.
Yes. All right. Well, what if my provider said only those experiencing a high-risk pregnancy should pay attention to their baby's movement?
We want all expectant parents to track their baby's movements. We do the gestational diabetes test, that sugar that you drink, that sugary liquid drink, for everybody. And everybody should be counting their baby's movements in the third trimester.
Yes. And what about this kind of numbers that they give about getting 10 kicks within 2 hours?
Sure. So every baby's different, and the recommendation to get 10 kicks in 2 hours is actually outdated. So what we want you to do is we want you to track your baby's movements to know what's normal for your baby. So my baby might get 10 movements in 15 minutes. Christine's baby might get 10 minutes or 10 movements in 35 minutes. She needs to know that 35 minutes is her baby's normal, and I know that my baby's normal is around 15 minutes. And the app or our paper charts will help with that. So if one day I'm counting and it's been an hour and 47 minutes and I still haven't gotten my 10 movements, I understand that's not my baby's normal, right? Because my baby's normal has been around 15, 20 minutes. So I'm going to call my provider and they're going to walk me through what they want me to do to come in, be seen, get checked out. So it's really important to understand what's normal for your baby, and this can help with that.
Yes. Well, Megan, can't I just use a Doppler device to monitor my baby's well-being instead of counting my kicks?
So I know there's a lot of apps out there that you can use and you can download, but we really don't want you to use them unless you're medically trained. Even if you go in with a change in baby's movements, your provider should be doing additional tests outside of just the Doppler, because a Doppler is the way they check the heartbeat. And that's one of the last things that could change when a baby's in distress. Whereas movements is the early warning sign and sometimes the only warning sign that baby's in distress. So we really want you to be tracking your baby's movements.
Absolutely. And we kind of talked about this one about how cold water or something sugary isn't the best intervention because we want to make sure we're getting to the doctor in time if something's going wrong. What about babies kicking less during the end of pregnancy?
Sure. So that's an old wives' tale, right? I remember my grandma saying, like, oh, you're about ready to pop and you have no room. And so it's really important to know that babies move up to and during labor. So you should still be feeling the same amount of movements in the same amount of time. So if you're tracking and you understand what's normal for your baby in terms of movement, that should still happen all throughout your third trimester up until delivery. And babies even move during labor, right? They're pushing, they're moving, they're getting through that birth canal. And so I just want to stress, we talked about that one, but I want to stress too, the one above that with the interventions, because I think there's some questions in the chat. And so what we really want to stress here is that with the app and the paper copies that you can use, which Christine's going to talk about here in a minute, is in the third trimester, every single day around the same time every day. So the third trimester starts at 28 weeks. We want you to start counting daily your baby's movements. So that way you get to know what's normal, what's the average amount of time your baby takes to get to 10 movements. So if you've been counting for 2 weeks and there's a graph on the app that shows you, here's my baby's normal, it's a pretty line graph. You can share it with your provider. I know I'm stealing your thunder with the app, Christine, but if
That's
baby's not
fine.
moving, if baby's not moving like normal, we really want you to call your provider. We don't want you to be drinking things or eating things, because like Christine just said, when you and I are sick, we sit on the couch, we rest, we're conserving our energy. Same thing with baby and the tummy. If baby's not feeling good, whatever the reason, we don't want to try and force baby to move with those interventions like drinking something, Mountain Dew, coffee, that type of thing. So please call your provider if you don't notice your baby moving like normal.
Absolutely. It's so important. Let's see. Slides are being stubborn today. All right. Well, Megan, I've heard that pregnant people should avoid dental care. What are your thoughts on that?
Please keep going to the dentist. Your preventative dentist visits are so important, especially during pregnancy. There's a lot going on in your body during pregnancy, especially in your mouth. So continue going to the dentist every 6 months and getting those checkups.
Yes, we definitely want to avoid any unnecessary tooth decay or infections. All right. Well, this is the exciting part where we get to talk about our app. So our free Count the Kicks app is evidence-based and it's available in 14 languages. Actually, we're already up to 16 languages. So 16 languages, including Amharic, Arabic, Burmese, Chinese, Dari, English, French, Haitian, Creole, Hindi, Marshallese, Russian, Spanish, Swahili, Vietnamese, Portuguese, and Hebrew. So we've got a little bit of something for a whole lot of people, and we're always adding more languages as well. This app is available for Apple and Android products. So we have, if you have an Apple phone, if you have an Android phone, or if you have an Apple Watch, you can use Count the Kicks on that as well. And they all sync together. So if you count on one thing and another thing, as long as you're on the same account, it's going to keep track of everything for you. One of the great things is you can restart sessions and delete kicks if you need to. So if you have another little one already and they're running around and distracting you while you're trying to count your kicks and you accidentally hit a kick button that you didn't mean to push, you can totally go backwards and add more as the kick session goes on. And the app also knows that you might not remember to count kicks every day. So you can set up reminders for a time that your baby is usually really active during the day, and set a time to count every day. And we do want you to count every day and look for those 10 kicks. And see how long it lasts. And then you can kind of see the little graph there that'll show you what the usual timing is for your individual baby. Count the Kicks is available for single babies or twins. And you can track future pregnancies in the same profile. So you can save the same one. And all of this history that you have within the app is able to be downloaded and shared with your provider. So if you do notice something that seems off, you can share that with them. We also have a strengths feature that allows you to track how hard your baby's kicking. So we've received some baby save stories through our platform that have talked about how the movements were similar in length, but they got really weak. And so that can be a warning sign as well to pay attention to. We really encourage you to download this app. And if you notice anything that seems off and your provider isn't available, hospitals are open 24/7 and they want to hear from you if something happens. So definitely don't be afraid to go in and be turned away. Like, they want to hear from you. They want to help you if something slows down. We also have a new update to our app. So we've added the Find Help section. So this is a great tool where you can go in and put in your zip code, and it will show you free or reduced cost services in your area that may be able to help you, that are related to you and your new baby coming along. So that's exciting. And finally, I want to share with you a video that kind of walks through our app and how to use it and how easy it is to incorporate this into your pregnancy. So I'll go ahead and play that.
The Count the Kicks app, a cutting edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker,
My goodness.
studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
All right. And before we finish up today, I did want to share a couple of stories of babies that were actually saved in Florida due to Count the Kicks. So this is baby Ryan. For baby Ryan, it was his mom's 3rd pregnancy. And she felt like kind of an expert at that point. She had she had 2 babies already. She was like, I got this. Luckily, her doctor shared with her the Count the Kicks brochure, and she was reading it one night, and it really resonated with her because her son had to be born, her previous son had to be born via C-section because his cord was wrapped a couple of times around him, and he had to spend some time in the NICU. So she wanted to see, she was hoping that she could prevent something like that from happening again. So she did her daily reminders, she kick counted, and she was noticing a reduction in movement around her 37-week appointment. And so she brought it up to her physician, and they said, you know, anytime a mother notices changes in movement, they want to run a non-stress test. So they did that, and they noticed that he wasn't moving enough to pass that test. And after an ultrasound, they decided that they needed to deliver Ryan that day. So Ryan was born with a knot in his umbilical cord, a true knot. And this is something that could have impacted his health long term. So it was very exciting that Ryan was able to be delivered successfully and safely on time because of Count the Kicks. We also have one other story, which is baby Deo. So Deo was part of a high-risk pregnancy. So they were seeing, Deo's mom was seeing a midwife, a maternal fetal medicine doctor, and also visiting the hospital for regular checkups. She was reminded frequently to count her kicks, and she noticed that she was getting some cramping around 3 in the morning and wasn't counting as many kicks as she would like. So she tried some of those interventions we talked about, the ice water, the sugary foods, and they weren't doing a whole lot, which we know isn't the suggested method, but that's what she did. And she ended up going to the hospital. And what happened was, once they got her on the monitor, they realized that she was actually having, the baby was having decelerations in their heartbeat. So after a couple of minutes of the heart rate kind of not being as consistent as they'd like, they ended up doing an emergency C-section to deliver Deo successfully. So it was a scary situation, but the end result was that she was safe and her baby was safe, and they were both able to have a healthy birthday. So here is our contact information. If you have any questions, we'd love to answer them. I'm Christine, and this is Megan. I realized I never introduced myself at the beginning, but we're happy to answer any questions in the chat. Megan, do you see anything?
Yeah, I'd love to answer some questions just really quickly. So somebody had asked about how can you tell about the movements, and what if we didn't feel our baby move? And so there's a couple of things I want to stress here. One, if you ever have concerns, absolutely go to your provider right away. Two, you really should start feeling those movements, around 20, 21 weeks, 22 weeks. And then we want you to start tracking the movements around the 3rd trimester, so 26 weeks or 28 weeks, because that's when research has shown that baby gets in that routine of when you can really start to feel those movements on a consistent pattern, a consistent way. And so if you ever have questions and you're not feeling movements daily, you're not feeling movements during the time when you normally track, and you've been keeping track of it and you've set those daily reminders, go to your provider right away. The other question I wanted to ask about was an Android device. And so the app should work on Android and Apple devices. You may have to update your software if it's an older version, but we'll also look into that on our end too. I know somebody had a question about that. So, but try and update your software, see if that helps. We also have paper kick counting charts on our website that we'll send afterwards as well. And soon we'll be releasing a web-based kick counter, so you won't even need a mobile device. You could count on your mobile device, or you can count on a PC. So make sure you sign up for our newsletter or contact us, and we'll put you on our newsletter so you can see when that goes live. It should be within the next couple of weeks. So we're super excited about that. So another way that you can count kicks. Let me just check the chat. So another question, consistent now, can I start early? I'm not sure how early you want to start for that person that asked that question, but I would start tracking at that 3rd trimester. So 26, 27, 28 weeks is when you'd want to download the app and start tracking 1 time a day around the same time each day when your baby's normally active. Somebody also asked, the app does not help with timing contractions. It's purely a baby movement counter. So it has resources like FAQs and some videos, but it's all about tracking your baby's movement. So there's no contraction counter on there. And then another question. So somebody commented about their provider, somebody's provider not always listening. And we're going to talk about empowerment and advocating with Jasmine here later on. But one thing that the app will do and help with is you're able to download your data. So you're able to download all your kick counts that you've been doing and show your provider and say, look, this is my baby's normal, or this isn't my baby's normal. I need to be seen. So always ask for that, download the data and say, I want you to see this. I want you to put in my chart, that you're telling me this, this, and this, and push. I mean, advocate, say, I want to be checked. I want an NST, an ultrasound. I want to talk to somebody else. So when in doubt, always get checked out, and make sure that if you don't feel like you're being listened to ask for another provider, ask for another nurse. You have every right to do that. And I know Jasmine's going to talk about that here a little bit later. So thanks for all the questions. I think we could continue on, Christine, to make sure we get through everything today.
Absolutely. All right, let's move it on along. All right. We have a quick little game. So who can guess in the chat what storybook this is referring to?
Who's going to get first?
Oh, we got a first one. One fish, two
nice
fish, red fish,
job.
blue fish.
Dr.
You
Seuss.
got it. Dr. Seuss. Yes. Great job, everyone. Okay, so next we're going to introduce Jasmine, and she's going to be talking to us about doulas. So Jasmine, would you like to pop on?
Yes, hi everybody. I hope you all are having a good morning. Congratulations to everyone that is currently expecting. Oh, let me turn my camera on. I'm sorry. There we go, so everybody can see my face. Hi everybody. So my name is Jasmine Hammonds, and I am the North Alabama Count the Kicks Ambassador. I'm also a doula, a childbirth educator. I'm a lactation consultant, and I just finished up some baby wearing training. I'm honored to be here with you all today to talk about doulas and self-advocacy. This is something that I enjoy talking about. So yeah, let's go ahead and get into it. We can do the next slide, please. Okay, so I know a lot of you guys probably heard of a doula, but for those of you who haven't and may be wondering what is a doula, here on the slide, I have a list of all the different types of doulas, right? Because there's more than one. There is a birth doula, which is also sometimes called a labor doula. There's an infant loss and bereavement doula, postpartum doulas, full spectrum fertility and sex doulas. All of them do different things, but here in the pregnancy and birthing spectrum of it, you'll probably find yourself using a labor or a birth doula or a full spectrum doula. And so the big difference between the two is that a birth or a labor doula is going to be with you during your pregnancy, through your birth, in that immediate postpartum period. But a full spectrum doula will go beyond that immediate postpartum time and may even follow you in your care for up to a full year. So those are really just the big differences between the two. And then since the pandemic, we can even throw in virtual doulas in here now because a lot of people are offering services online for anyone that's unable to, be able to be seen in person. I can go to the next slide. So there is a difference between a doula and a midwife, right? And everyone is like, well, what is the difference? I have a midwife. Do I really need a doula? I have a doula. Do I need a midwife? So a doula and a midwife are both going to take care of you from start to end. They're going to be, your care champions. They're going to support you and your birth partner if you have one, and whatever your birth plan looks like. The biggest difference is going to be is that a midwife is going to actually be the one to deliver your baby. So you can think of a midwife in the space of an OB. Sometimes people even have a midwife and an OB, but between the doula and the midwife, that is the biggest difference between the two. So depending on where you live at, if you do have a home birth, a midwife has to be present. So you will want to, reach out to whatever doula that you're using or midwife that you're using to see what that will look like for you. We'll go ahead and go to the next slide. Okay, so I know sometimes that you may be wondering like, oh, I have this question, or my provider is probably like wore out from me calling, or when I go to the appointment, I got my paper with like my top 4 questions. And you may be like, well, I don't know if I should ask. Is this challenging my provider? Am I, showing a sign that I don't trust what they're doing? And let me tell you, I'm a mom of 4, and I know like what it's like to be like, okay, I got a question, and it's like, okay, well, you may have been down this road before, but it's like, well, I still have a question, right? Because everything is going to be different. Every pregnancy is different. Every baby is going to be different. And if you have that feeling to where it's like, I just don't quite understand why this is going on, or I just need to get more information about, doing that glucose test or whatever the case may be. Do we have to do a membrane sweep right now? I really just, don't feel like it. Ask the questions, right? Ask the questions. Your provider is not going to be upset with you. I worked in the ER. We say, come on in. We're here 24 hours. Your provider is going to tell you, call me. They have after hours support, and they are there to support you. So don't feel like you're bothering anyone. Don't feel like, you're being a burden or anything like that. Ask the questions anyways. Go be seen if you feel like you need to be seen. So you may be wondering, well, what questions do I ask? Because you may went in there with the intention to ask a certain question, and then later on you're like, oh, well, what I should have asked this or whatever, or it wasn't explained to me right. So this brain tool is really super handy that you can use, keep in your back pocket. And the brain is an acronym, and so it'll kind of help you start those conversations, kind of help you ask those important questions. So we can see here that B stands for the benefits, right? You just want to know, like, what are the benefits for the procedure? What's the pros and cons, right? Wanting to know the risk. Is there any risk factors to anticipate if I do this or not? Alternatives. What are my other options? Are there any other options, right? So just asking those questions. Can you have more time to think about it? Can you go home and kind of just sit on it a little bit, see how you're feeling about it? Or is this something that needs to be done right away? And then what is your gut, again, telling you? We all have that feeling to know if something just isn't sitting right. And then if it's not feeling right, hey, ask the questions. And that's where it comes back to saying, hey, what does this mean? Or do we have to do this? So using the brain tool is going to be really, really helpful for you. So we can go to the next slide. And speak up. That's just a part of using that brain tool and advocating for yourself. You are going to be your best advocate. You're going to be your baby's best advocate. And using your voice, being heard, is just what you have to do sometimes. Your provider, they're seeing patients. Your doula, is taking care of you, but they don't know if you don't ask, right? And so they may think that you may understand something if you haven't mentioned anything. And so they may just be talking and you're just looking and you're smiling and nodding your head in agreement. And in the back of your mind, you're like, what in the world? So speak up and say something. If something isn't right, speak up, call your office and say, hey, I don't think baby is moving, right? We just learned in the previous slides from Megan and Christine that anything that's not normal is something worth making having a concern about and bringing it to your provider's attention. So that's something that you can speak up about and say, hey, I've been tracking movement and this is not normal for baby. And if they say, well, how do you know, or whatever, like, I have this, this app that's going to help me explain that to you. So a birthright, there are several different ones that you have as a birthing person, but this one right here is like my main one, is that you have the right to receive treatment when you're in labor or you're experiencing a medical emergency. And that just kind of goes back to advocating for yourself, going into the ER, to your provider's office if you feel like you need to, and being seen when something is wrong. You have that right as a birthing person. We can go to the next slide. So true or false, doulas are only support parents who want to birth at home. And that's fine. And that is absolutely false. You can show the slide. So doulas will definitely support you if you plan to birth either in a hospital or in a birthing center. It does not matter if you're even at home. Again, if you do decide to birth at home, just check with your local area to make sure that you don't have to have a midwife, but a doula is there to support you in any birthing plan that you may have. Our next slide. So what about this one, guys? True or false? Doulas only support parents who plan to have an unmedicated vaginal birth. I see some falses. Yep, false, false, false. Absolutely. Let's hit the next slide. So that is right. That is false. Your doula will support you if you plan on having a vaginal birth with epidural, or if you want to have one with unmedicated. If you're going to have a C-section, rather that's planned, or even an emergency C-section, your doula will also be there with you. If you want to have a water birth in a birthing center or at home, your doula is going to be there to support you again in whatever birthing plan that you may have. And then when those emergencies do come up, because we know plans change, so if something goes differently than the original plan, your doula is going to be there also to support you in that as well. And we can go to our next slide. So how do you get a doula, right? If you're unsure how to find a doula, none of your friends have had a doula before, and you're like, well, where do I get one of those? They're always on social media. We post on social media because we are in a time where social media is just what it is now. So you can search for a doula in your area on social media. You can reach out to friends or other family members, but you can even talk to your provider because they also have connections with doulas in your local area. And they can just pass on some information to you to let you know who's in your area, and you can set up some doula interviews. And our next slide. So what does a doula do? Doula do. A doula can help teach you with breathing and pain relief techniques that can be used during the labor and birth process. And as we see here in our picture, this doula is just helping mom with some comfort. You have those lower back labor pains. Oh, if anyone's had experienced that, then you know how some relief can feel for that right there. So a doula can learn some massaging techniques, some pressure points. They'll do them themselves. They can either teach your birthing partner or friend or whoever you have with you. They can teach them as well to do those techniques during your laboring process as well. We can go to our next slide. So what does a doula do? They also educate you. They educate you on the process of labor, childbirth, and how to prepare for postpartum. They're going to, let you know what the signs of labor looks like, how to tell those contractions if they're true or false, knowing when to go into the hospital or not, or roughly about what time we should start getting ready to get our things together, making sure that hospital bag is packed. They'll teach you breathing techniques, when to push with the contractions, how different positions that you can push in. So doulas are also educators to try to make the birthing experience as easy, healthy, and positive as possible. Our next slide. And then doulas also will help you map out your birth plan. So a birth plan, birth goals, however you resonate with it, is just a plan. It's just a goal, right? It's something to give you an ideal of what you would like for your labor and your birthing and postpartum to flow. Sometimes we get ready to have that baby, you hit those contractions, and the only thing that we're focusing on is how many minutes has been between those each contraction and getting to the hospital or getting into the birthing facility that you're going to get ready to labor at. And everything goes out the window. You may have said, oh, I wanted to have, some calming music around me. And that's the last thing that you thought of. So having a birth plan in place is just going to help keep things, your wishes, even if things are being recorded, if you want someone to take some pictures during this particular time, if you want to have your hair up in a ponytail, just those comfort measures and things like that. If you want baby to go straight and get cleaned off, or if you want baby to put right on your chest afterwards, whatever that birth plan is. And so that way, your wishes are, going to be granted if everything is going according to plan. And then that way you can focus on delivery of your baby. And then everybody is on board as well. So if you can't speak up for yourself, your doula or your birth partner can. And then if something does go into an emergency action and you're unable to speak for yourself, having a birth plan will be your second voice. And that's how I like to look at it, as having that backup second voice in place to make sure that your wishes are still honored the best that we can. And the next slide. And then another thing that a doula do is going to be able to provide you with phone, text, email, and even video support. So that's, depending on the doula, how that looks for you, the appointments after, provider visits, separate appointments to come in and do some, breathing or massage techniques, some virtual support. If you're having a birth and they need to video during that, it can be at the hospital, whatever that looks like for you. But your doula is going to be there by your side, right? They are that person that's going to be in between you and your provider. They're that extra cushion, that extra voice, that extra person to lean in on that's going to support you in your pregnancy and birth. And they're also going to remind you to count your kicks, which we just learned is very important, especially during the third trimester. And our next slide. So, what are some benefits of having a doula? Of course, each doula is going to be unique in their own ways. The services that they provide, they may do just doula, where they support you during your birth and labor, or your labor and birth. And then they may also offer nurse or lactation services. So it kind of just depends on what they provide in their services. But the benefits is going to be, limited or unlimited rather. But we do know that having a doula, it has been shown to have less likely to use pain medications. The birthing person is less likely to have a C-section. They're less likely, to need any interventions. It could possibly shorten labor because you have someone that's going to be there to relax you, keep you calm, lower your anxiety down. That can also help us shorten the labor, because we know when our body is loose, things happen. When we tense up, that can kind of progress things. The newborns were shown to have less likely to have poor vital signs 5 minutes after birth. Parents are more likely to want to nurse after the birth of the baby because they've had some prenatal education. So they're kind of prepared on what to do when the time is to do it. And it can also help lower the rates of postpartum depression. And that is because you have someone that is skilled, that has that extra downtime to explain to you, to educate you, to prepare you for that postpartum period, which is very important. And so if you don't have a postpartum doula to take over, your labor doula will definitely get you prepared and where you need to be to make sure that we are taken care of during that postpartum period as well. The next slide. And that's actually it. So thank you all so much for your time. Again, my name is Jasmine Hammonds. My information is here on the screen. You guys can feel free to reach out to me at any given time with any questions. You can drop it in the chat. And then, yeah, so thank you so much and congratulations everyone again.
All right, thank you so much, Jasmine. Let me just peek at the chat and make sure there's nothing that needs answered right away.
Okay.
Okay, not seeing any immediate questions right now, so we can go ahead and move forward. So we have another quick little game here. Who can guess the fastest? Which story do you think this is? Oh, we got it. Rebecca with the green eggs and ham. That's right. Good job, everyone. Okay, next. We're going to move into an amazing labor and delivery presentation with Mai. Let me make sure she's on. She is. Okay, perfect. Mai, are you ready to go?
Yes, I am. Hello. Hi,
Awesome.
everyone. Hello, hello. Right, let me get my lighting right. Okay. All right. And then my background. Hold on, give me a second. I guess I should have did this. Hold on. Let's give us something nice there. Okay, that's totally fine.
All right, oops, sorry.
Did I do it?
All
Okay,
right.
it's okay. I
We
just
are
don't want the light to be too blinding. Hello, everyone. Good afternoon. My name is Mai Waller, and I am here to present the What to Expect from Labor and Delivery. This is through my nonprofit organization, the Mace Anthony Williamson Foundation, and I am extremely happy to be here with you all. So congratulations on your new journey. It's definitely a crazy territory to be in, but it is the most beautiful journey that you will probably ever go on. So I just want to tell you congratulations. And you can go to the next slide. You're welcome. So welcome to What to Expect, Labor and Delivery 101. So in this presentation, I'll discuss the best ways to manage labor pain, to the phases of labor and the labor procedures you'll possibly undergo. So just learn as much as you can, and take some notes to take back to your provider, because I know that you cannot wait to have your baby, but you want to make sure that you're prepared for what's to come, and the possibilities. Next slide. Of course. All right. During the 3 stages of labor, of course, your body prepares for the birth of your baby, stage 1, and the delivery of the baby, which is stage 2, and then the delivery of the placenta, which is stage 3. And throughout the labor, of course, your body will contract and dilate, to efface your cervix, excuse me. And you can, learn about the difference between true labor contractions and Braxton Hicks contractions, and signs of labor and what to do once you're in labor. Now, as far as Braxton Hicks contractions, those can definitely, trick you into believing that you're in actual labor, and you're not. So those are the times where, especially if you're a new mom, you'll go to the hospital and they'll turn you, they'll have you go back home. And that's, I honestly, I don't like that, but it's something that, when your body isn't ready yet and your baby is not ready yet, that's kind of the best thing for you to do, is just labor, naturally. Those Braxton Hicks contractions, yes, they are extremely uncomfortable, but of course, the help of an amazing doula, she will be able to support you during those Braxton Hicks, give you different techniques of how you can lay a different way, and massage techniques for your partner to do on you when she isn't around. And then true labor contractions, of course, those are extremely intense, and they tend to come within 2 to 5 minutes apart of each other. So that is how you will really know that it's time, you're in labor. And this is, sometimes without the water breaking. You can go to the next slide, which I'll go over that too, the water breaking part. So as your body prepares for the labor and delivery, this process is, when your baby is actually born. Labor is often different for each person, and that is extremely true. Your cousin's birth may not be the same as your best friend's birth or your birth. It's all about the baby and your body. So that's what kind of makes each process different. Some labors, of course, like you see here, they're quick, and some are long and difficult, and they don't go, as you plan sometimes. And then other people even experience, stalls in labor, and they may need like an induction or, medication to start their birth, or sometimes get the water broke for them. Next slide. So early labor, the average labor is usually between 12 to 24 hours, especially for a first birth. And more than likely, after that first birth, the labor gets shorter and shorter. And throughout this time, you'll experience the 3 stages of labor that I mentioned before. And the first stage of labor is usually the longest, which you're contracting and extremely uncomfortable. You're at the hospital probably, or you're laboring at home naturally before, you just can't take it anymore. You feel like your baby's coming, or your water's broken. You just really want to go to the hospital at that time. The beginning of this stage is called early labor, and early labor is described as you dilating from 0 to 6 centimeters. And we can go to the next slide. And active labor. So as you make progress during the active labor portion of the birth, excuse me, the contractions become stronger and stronger, and you'll move into the second part of the first stage of labor called active labor. And that is when you're dilating between 6 to 8 centimeters. They'll check you, of course, for, to know where you're at as far as centimeter wise. And then you would transition into the second stage, which is the 8 to 10 centimeters. So that's when, you are ready to go. That cervix is completely thinned out and, your body is pretty much ready to deliver that baby. And of course, the contractions are stronger and stronger, and your cervix opens up. And the second stage of labor is when you push, everyone's favorite part, but the part that's kind of painful, but it has to happen, to get that baby out of here. If labor was meant to be pain-free, I don't think they would call it labor. It's hard work. Labor is hard work. Next slide. And the afterbirth, look at that beautiful baby. That's what you went through those first 2 stages for that beautiful face to be right in yours and just loving you. So that third stage is the point where you deliver the placenta, which is where your baby has gotten its nutrients and everything for 9 months for you, so 40 weeks. And this is called the afterbirth, which it is kind of uncomfortable to experience that. I've had, 3 children, and I can remember, having that nurse come in every 15 minutes and pressing on my stomach. So if you're not a first-time mom, you already kind of know what to expect. It's for your safety. It's for the health of you, really at that point, and your baby, especially if you're breastfeeding, because that baby really needs you at that time. So we want to prevent you from, bleeding out or, in any way or being harmed in any further. So that's why they come in and perform that procedure on you, just to make sure that your body is good and that placenta is completely out and you don't bleed. Next slide. Terms to know, dilation. So this is the process where your cervix stretches and opens to make way for your baby's birth. And that is measured from 1 to 10 centimeters. Your provider will do the vaginal exam to check how much you've dilated throughout your labor. And you will be 10 centimeters by the time you're in that second stage of labor to go ahead and deliver that baby. You absolutely have to be, to push a baby out. Not saying that every time will be that way as far as pushing. Some people may have C-sections. So, you may not be at that 10 centimeter mark when you have to get a C-section, but to vaginally deliver that child, you have to be at the 10 centimeters to have a safe and healthy delivery. An effacement is the cervix not only stretches during labor, but it also becomes thinner. So the shortening and thinning of your cervix are measured by percentages. So you'll progress from 0% to 100% effacement during your labor. And you'll hear those terms that they use. So at least you know now exactly what that means when you go in and you hear them saying, oh, your blah centimeters dilated and blah percent effaced, you'll know exactly what they're talking about. Because it's especially when you're a first-time mom, it is extremely, difficult to navigate the labor and delivery when you're not familiar with the terms that they're using for you. And I feel like to have the most empowered birth and to have the most resources, you want to just have people that can educate you along the way. So as Jasmine mentioned, doulas have extreme knowledge as far as how the birth process should go. And then they will empower you throughout that and give you the educational resources that you need to feel confident, to feel empowered while you're in the the labor and delivery room. Next slide. How will I know when I'm in labor? That's the big question. It can be difficult to know when you're in true labor. So first-time parents, like I mentioned to you, they may mistake other symptoms like Braxton Hicks contractions for true labor, but true labor does have a pattern and it progresses over time. So those, not the centimeters, well, of course the centimeters too, but the contractions that you're having, it becomes more like a pattern. So that pain comes like every 2 minutes, then it stops. And then it comes back again and then it stops. So that's when you'll know it's like, okay, it's time. And also when the water breaks, that's a great time to go to the hospital, to call your provider, let them know, hey, my water's broke. I need to, go to the hospital now. I believe it's time to deliver my baby. Next slide. Three things that you'll want to look for when you're in true labor. As I mentioned to you before, the frequency. So how often are you feeling those contractions? So you can keep track of those. You can have your partner, set a timer on your cell phones to determine, how far apart those contractions are, and just making sure that they're, coming in regularly. Duration, how long are each of your contractions? So as the labor progresses, your contractions last long. So you can use a stopwatch and watch a clock, or keep the timer, again, like I said, on your phone, so that you can record the length of each contraction. Gosh, this is such a great picture. This woman is giving birth, you guys, in this picture next to us. It's amazing. Oh, that's gonna be you guys. Oh, it's a video too. Look at there. I'm sorry. I'm actually pretty fascinated myself. Birth is beautiful. Intensity. Are your contractions getting stronger? So contractions can get stronger, and you might feel them more intensely, as you move through the stages of labor. So your best bet is honestly to just keep track of those contractions and how they feel over time. Now, sometimes you can be like 3 centimeters and go to the hospital because you're feeling in pain. And this is one thing that I can't stand it, because I'm a doula too, and I had this happen to one of my clients. Just the her being 3 centimeters when they checked her, and then wanting to send her home, but you have the right at that moment, with you being in pain, if you feel it's an emergency, to be kept at the hospital if that's what you feel, especially when you're at that 40-week mark, 38-week mark. You want to make sure that they're doing everything that they can to take care of your needs, and make sure that your requests are respected, and that you are given all of your options at that point. Let me walk around the hospital for a little bit. Maybe I might dilate a little bit more. It's so many ways to get the process going, other than just being sent home. When you feel like, okay, I've been back and forth here, and just keep getting sent home, you can make those types of calls if you would like to have them keep you there and let you labor at the hospital. Or my preference is, of course, to labor at home until you feel like you just can't take it anymore. Next slide. Are there any signs that I will go into labor soon? Good question also. Many women have several pre-labor signs that hint at when labor will start. So this includes backaches, diarrhea, weight loss, nesting. So, cleaning and organizing everything. So those are really great ways. You can also go to the next slide. I believe I added some more. Oh, I didn't. But again, those are really great ways to know that you're preparing for labor, especially the nesting part, because you're so anticipating that baby, and you know your body better than anyone. What's the mucus plug, and what does it mean when it falls out? So the mucus plug is a thick piece of mucus called a plug, and it blocks the cervical opening, so that prevents any type of bacteria from traveling to your uterus, any infections. So when the cervix begins to soften and thin and open, the mucus plug is expelled. And not every mucus plug will look the same. Sometimes it's bloody, sometimes it's pink, sometimes it's clear. But labor could start shortly after you lose your mucus plug, or it could begin several weeks later. So don't think that because your mucus plug has fallen out that, oh my gosh, it's time to have the baby, because that's sometimes that's not the case. And again, your baby is in a beautiful sac and it's safe. So, if that happens, definitely call your provider for sure to get their medical advice for you. But again, it could be weeks before. And once the mucus plug comes out, it's not, an organ that, reproduces itself. That's kind of it for that. You can go to the next slide. And don't be worried. Don't be, extremely worried when you see it. I know it's pretty hard to not be freaked out when you see your mucus plug. You're like, oh my gosh, what is this? But you can call your provider to confirm what it is. But just so that you have some knowledge to take from these slides, just know if that happens. They also call it a bloody show. I'll put that in quotes, a bloody show. So that's another term that is used to describe the mucus plug. Coping with contractions. There, of course, are also many ways to deal with the discomfort of labor at home without medication. So no epidural, no Stydol, none of that stuff. You can take a walk with your partner, go shopping, watching a movie, soak in a bathtub, take a warm shower, but make sure that you speak with your healthcare provider about taking a tub bath, like a sit down bath, if your water has broken. If your water breaks, you kind of would want to do something alternative to taking a sit down bath, maybe a shower, because I can remember that. Sitting on a birth ball, listening to some music, doing some aromatherapy, dimming the lights. You can go to the next slide. I believe this is the one I added. Yep, aromatherapy, get a massage. Definitely call your doula too. That is the really big thing, because they will, be able to give those massages. Do the peanut ball with you, and just different positions to help you be more comfortable. You can stay in an upright position, which can help with the rotation and the descent of your baby. As you know, at the hospital, they have you lay on your back, on the hospital bed. And in some labors, you see someone standing up to deliver that baby. That is a preference. It does not have to be the way that everyone else does it. It does not. It's your body, your baby, but it's also what's medically necessary as well. Just for instance, if a C-section is something that happens, you can't do a C-section standing up. It has to be where you're, medicated and safe, and you will get the surgery to deliver your baby. Also try to sleep, because like this slide said, you want to save your energy for when you're in active labor and delivery, because like I told you before, it is hard work. Your body is working overtime to prepare for this new, baby that is about to be born, and it takes a lot, and it takes a lot of your energy too. So try to rest as much as you can, especially in the weeks, coming, in that before that 40-week mark, where you kind of know and expect something to happen. Try to get some rest, and also, to cope with those contractions, definitely sleep, as much as you can through those. It's kind of hard to sleep through the contractions, but it's definitely possible. It's definitely possible. You can go to the next slide. All right, the magic question. How will I know when my water breaks? So you, of course, may be very familiar with the common phrase of "my water broke." This is actually the rupturing of the amniotic membrane. So that beautiful sac that holds your baby, it, of course, breaks, and that's where that fluid comes. So during pregnancy, your baby is inside of a fluid-filled sac, also called your bag of water. And when this membrane breaks, you might feel that trickle, or that gush. It may sound like a water balloon breaking, like or the sound of what a water balloon will feel like. It will. I can't imitate that sound at this very moment, but it does sound similar to that. Like many parts of labor and childbirth, this experience can be different for each person. So that fluid, just to give some insight on that, is odorless usually, and it may look clear or like straw color, like a wheat color. But yeah, it won't always happen. Everyone doesn't experience the water breaking. Sometimes they may break your water in the hospital to kind of get things started as well. You can go to the next slide. When should I call my healthcare provider or go to the hospital? She looks like she is just not having it. That looks like a back labor right there, how she's holding herself. But when you start to notice that you're having regular contractions, please call your provider and talk to someone about when you should go to the hospital. And the next person, call your doula or your partner, whoever is going to be there to support you, your support person. And then some women are actually able to stay home throughout early labor, while others may need to, come in sooner. So my advice is to, one, take the medical advice that you've been given, or if you feel, like, okay, I can do this, I can breathe through this, your doula's taught you different breathing techniques, your partner's there to support you, and you feel that you're able to do this at home, absolutely, do what you feel the most comfortable with and what you can withstand until it becomes unbearable. Next slide. All right. So that's another, really big thing. What happens once you're at the hospital? So when you get to the hospital, of course, you check in at the labor and delivery desk, and you will go to the triage room. Most importantly, that's the first thing that will happen. They'll usually check you at that time, especially if your water's broke. They'll lay you like on a pad. Unfortunately, they'll lay you on a pad so that you're able to get some of that out and not mess up your clothes. Of course, you'll put on the hospital gown once you're taken to the labor and delivery room. Your pulse and blood pressure, your temperature will be checked. And of course, they're checking temperatures more, well, they always do, but this is like a really critical time because COVID-19 is, ever so prevalent. And then also an external fetal monitor will be placed on your abdomen for a short time to check the uterine contractions and measure your baby's heart rate. And those same, that same fetal monitor will actually be on you for the duration of the time that you're in labor. Basically, it's they are blue and pink, and they go on your tummy. Your healthcare provider will examine your cervix to see how far labor has progressed. So, like I told you, the dilation and the effacement. And you may be given an IV in your arm to deliver fluids, just in case they don't want you to become dehydrated. So that's why sometimes they do the IV and other medications, which are also they're there for you to say yes or no to. It's not, unless it's a medical emergency and that has to happen, you have an option at that point. And of course, the doula that you have or may not have will be able to help through that process. Of course, with that birth plan, if you have that in place, like, hey, I'm good, I don't really need that, just give me some ice chips. I don't really want to do it that way. And medication, if you feel comfortable just laboring through it and you want to have a completely natural birth, that's another option that you have. You do not have to get epidural at all. That's a choice. Next slide. What does it mean to have labor induced? Amazing question. So of course, like I mentioned to you all, labor does not always start naturally or progress, as it should, with that 12 to 24 process there or hour span. In these cases, your provider might talk to you about inducing labor. And this is a medical procedure where labor is started by your healthcare provider. So it's called Pitocin. And this should happen if you are past your due date, have health complications like high blood pressure, preeclampsia, infections, or diabetes, had your water break but did not start labor, and have low levels of amniotic fluid, which is super important because, again, that's how that baby is. It's still in there, and it's still, that's what it's kind of used to at that time until it gets the oxygen from when it comes out of your tummy. You can go to the next slide. And your labor can be advanced or induced in several ways. So I'll just kind of break these down by using medications given through an IV directly into your vein, breaking your amniotic sac or your water breaking, separating the amniotic membrane, so the sac of fluid that the baby is inside within your uterus from your uterine wall. So that is called a sweeping of the membrane. Oh, God, so painful. I'm sorry, I have to say it. So sweeping of the membranes, softening your cervix and encouraging it to open with medication that can be placed directly into your vagina. And labor induction can take longer than spontaneous labor because the cervical ripening process takes time. So even though they're trying to progress you, it can still, take longer for you to have that baby and to see your beautiful baby on the other side. So I kind of won't give too much advice on that, but it's all about what the mother is most comfortable with and what's most necessary at the time of that delivery. Next slide. All right, types of deliveries. There are two types of delivery, which is vaginal and a cesarean section or C-section. And during a vaginal birth, your baby passes naturally through the birth canal. And then in a C-section, it's a surgical procedure where you're given a spinal tap to numb your body well, not the whole body. It's not the whole body. It's from like maybe I can't really stand up and do it, you guys, but it's not your whole body. I'm sorry. So where your provider makes an incision or cut into your abdomen and delivers the baby in an operating room. So I believe at that time you can have maybe like one support person for you during that C-section. And vaginal delivery, of course, is the most common type of birth. Thank you so much from the tummy down. Thank you very much. I appreciate it. I'm like, I was trying to show you exactly. I guess it'll be different for me because I don't have a baby up in there. Vaginal delivery is the most common type of birth. However, sometimes you may need a C-section for, a variety of reasons. You can go to the next slide. I believe I explained. All right, well, I didn't explain it. So a C-section, you could, that baby you could be laboring for too long, and they really would want you to have an emergency C-section. The baby heart rate might be dropping, or yours may be dropping. Anything that's, critical to your life or that baby's will also cause a C-section too. So it's an emergency C-section is just exactly what it is. It is an emergency, and it has to happen. There's no other way. And I also said that I would cover some tips for the VBAC for you all. So just because that's not something that I had actually in my slideshow, but as far as support for a VBAC, I would say find a supportive medical provider, because all medical providers don't, say, okay, listen, I do VBACs. Some of them don't. Also, get your support team on board. So your doula, you want to make sure that your doula supports you during that time. Your partner, again, your medical provider. The next, of course, advice was to hire a doula and just prepare for that. Prepare your mind and your body for that, because it's a whole different process for you. And it, of course, it carries its risk, which I kind of won't get too much into. That's something, if you were inquiring about that, I would ask you to contact your medical provider for that, to get their advice on how to move forward with that process, and if they're able to assist you during that process. But my best advice, honestly, is to time it wisely. If you just had a baby last year and you're pregnant again, which it happens, and you had a C-section, my advice honestly would be to probably have a repeat C-section, unfortunately, because it's just such a short period of time. Now, it can happen. You absolutely can do it. But again, that's something for you and your medical provider to discuss with each other and, know your best options moving forward. So in summary, you are absolutely bound to feel a lot as you prepare for the delivery of your baby. Your body is absolutely going to go through so many changes in a very short period of time, especially that third trimester. Your body is going to change so much. You're going to see so much growth in your stomach and your baby. You will have a lot more pain at that time. 18 months, correct. Thank you so much, Christine, for saying that. I appreciate that. 18 months. But it's totally normal to feel excited. It's normal to feel nervous. It's normal to feel scared, about what can happen, just depending on the birth that you had previously. Discussing the signs and symptoms with your healthcare provider can help you know what to expect. Your partner and healthcare team, such as a doula or a midwife, are here to support you, and they will help you regain any confidence that you may feel lost. And they'll also help you to remain as comfortable as possible during the delivery process. You see the little doula, get a doula if you are able to. Next slide. All right, questions. I'll be taking questions, and then we can go to the next slide. All right, and that's me. Thank you all so much. I appreciate you allowing me this moment to present and to educate you, and just, leave you with some really valuable resources. And I'm sure Christine will let you know how you're able to access these slides at the end. So yeah.
Yes, thank you so much, Mai, for all of your wisdom that you shared. And if you guys suddenly have thoughts about labor and delivery, feel free to drop those in the Q&A and Mai can take a look at them. But we're going to go ahead and move on to our next little game we have here. So who can guess quickly what this storybook is? see who's fastest. Good night, Moon. Rebecca, I think you got it first twice in a row now. Good job. It might have been another Rebecca. I'm not sure, but yes, Good Night, Moon. Love that book. Margaret Wise Brown. All right. So next, we're going to hop into some great information about baby basics and newborn care. Donna, are you good to go?
I think so. Can you hear me?
Yes, I can hear you. And do you have your notes and everything pulled up? You good to go?
Yep, I should be okay. Thank you.
All right, perfect. Then I will hop off camera and I'll let you take over.
Oh, actually, I can't advance the slides.
Yes, if you want to let me know when you want to move forward, just say next slide and I can go ahead and move them forward for you.
Okay, thank you. This has been a trial and error thing this morning. So, well, I guess it's afternoon. Good afternoon. My name is Donna War. I'm a registered nurse and a lactation consultant, and we'll be talking about some baby basics and newborn care. So now the fun part starts. Next slide. So what to expect after birth and how to care for your baby, and we'll talk a little bit about feeding your baby as well. Next slide. So once the baby's here, what's next? If you have any questions throughout your pregnancy or while you're in the hospital, it's ask questions. No questions should be left unasked. You have nurses around you that you can ask anything you would like. Most hospitals have a lactation consultant available. You ask your pediatrician, your OB, and some insurance do provide newborn home care services. Also, some insurance provide lactation outpatient consults. And if you're eligible for WIC, they have a free lactation consultant there as well. Next slide. So handling your newborn baby. Babies are fragile, so handle with care, although they're not going to break. So you can, move them around without being afraid. Next slide. Next slide. Bonding in the first hours and days after birth. Cradle your baby gently, stroking your baby. Do skin to skin. Right after birth, your baby should be awake in that first hour, and typically we allow the moms to hold skin to skin. And if you choose to breastfeed, the baby can go to breast at that time. So that promotes bonding, also increases the hormones if you're intending on breastfeeding. And then after that, the babies are sleepy for about the next 24 hours. They wake up a little bit now and then, but you want to stroke your baby, talk to your baby, sing. Make sure you're supporting the baby's head and neck. Your baby does recognize your voice. And any other individuals that were around the baby while you were pregnant, you will notice the baby will kind of, indicate that they recognize those voices as well. Anyone who's going to be handling the baby, whether it's you or visitors, anyone should be washing their hands before picking up the baby or sanitizing their hands. The process of bonding is different for every parent and child, but that direct skin-to-skin contact in the early days for mom and partner is very important for bonding as well. And that does help with close emotional bonding that promotes growth and development. Next slide. So newborn screening tests will be done in the hospital, and they are, sorry, my computer wants to kick me out. Okay, there we go. Newborn screening tests will be done in the hospital before you and your baby go home. They do cover genetic endocrine problems, babies, hemoglobin, immunities and metabolic conditions. They also do a testing for heart defects and hearing loss. The first ones are a blood test, which is done by a heel stick. So they'll prick the baby's heel, and then the blood will just, little drops drip onto a card where they send it into the state for testing. The heart defect testing is just like, it's a little probe that's wrapped on the baby's foot, looks like a Band-Aid, and it just picks up a number that we look for the blood saturation. And as long as they're within a specific range, everything's fine. Hearing loss, they do a hearing screen test in the hospital before you take your baby home. So someone will come around and they just put like little cups over the ears and then little stickers on the chest, and they'll let you know if the baby passed the hearing test right then and there. If the baby would not pass the test, they will repeat it. And that can be done on an outpatient. Next slide. So baby skin care, the first bath may not occur until 12 to 24 hours after birth. During the first bath would be a sponge bath, and you don't want to do the bath too early because the baby can get cold. It can cause unnecessary stress, lowering the baby's temperature and lowering the baby's blood sugar as well. We do not recommend the use of baby powder because the baby can inhale the baby powder. Now, skin to skin, it's contact. So holding the baby skin to skin before the bath helps to warm the baby, and after the baby will help as well. Some hospitals require that the baby is double bundled right after the bath. So it depends on what your provider is recommending. So clean the diaper area during diaper changes. You always want to clean like front to back, especially with a little girl. So any debris, if the baby had a poop, you want to take it backwards so it's not coming forward to enter any openings that could lead to an infection. The recommended bathing is 3 times a week once you're at home, or after the cord falls off, you can begin to tub bath the baby. So you can put the baby in a little basin, a sink, or baby tub after that. Before that, it's going to be a sponge bath. You would check the water temperature by running it over your wrist. You want to make sure you're keeping the baby warm, using soap sparingly. You don't need to apply soap to the eyes. You would use like a cotton ball would be softer to use on the eyes, wiping from the inside of the eye out. Also around the umbilical cord, the stump, you would just use like a little cotton. You can use a cotton ball because it's softer. My computer keeps wanting to kick me out. There we go. You can use a cotton ball around the stump as well. Lotions and creams we usually don't recommend early on. They can cause irritation to the skin. Many newborns may peel and their skin may flake up to 3 to 4 months. So that's all normal. Next slide, please. So if you have a baby boy that you choose not to have circumcised, you just clean him bathe a baby just like you would the rest of the body. You do not need to retract the foreskin. Your pediatrician would make recommendations of when they think it's appropriate to retract the skin and clean underneath. Next slide. So if your baby is circumcised, usually we do that in the hospital before discharge, because we usually want to make sure that the baby has peed before you leave the hospital. So we want to make sure the baby is having urine output. We usually put a light dressing with some Vaseline right after the procedure. And you want to make sure you're keeping that area clean by gently rubbing with clear water. The tip may be red for the first couple days. That's normal. Yellow secretions is also normal. If there's any increase in redness or swelling, yellow crusty sores, that is a time to call your pediatrician just to make sure everything's okay. Next slide. So umbilical cord care, we want to keep the stump clean and dry. We no longer recommend using alcohol wipes to dry up the cord. It will shrivel and eventually fall off on its own in about 3 weeks. You want to make sure you're keeping you don't want the diaper to go up over the cord. You want to just fold that end down. So if it's over the cord, the diaper could irritate it, pull it, and cause it to bleed a little bit. So we want to keep the diaper away from it and fold it down. When the cord does fall off, you may see a couple of drops of blood. That's normal. If it gets like little scabby and looks like it needs to be clean, you can use clear water with a cotton ball to wipe it down, but you also want to dry it because we want it to dry and fall off. Signs of infection would be a foul smelling. You may see some discharge. The skin around the base of the cord on the belly may get red, and the baby, would be crying when touched. So those are, again, times to contact your pediatrician. Next slide. So we will give you information when you're in the hospital on the period of purple. And that means when the word period means from when the baby begins the crying into the end of crying. Crying is the baby's way to communicate hunger, discomfort, or if they're overly tired, respond promptly, of course, to any baby crying. Also, if the baby has colic or is purple crying, don't be afraid to take a break and calm yourself. You can switch off with someone else to help calm the baby down. But if you do see some purple during the baby's crying, that can be normal. The peak of crying, your baby may cry more each week, mostly in the month 2 and less in the first couple months, and less in months 3 to 5. Could be unexpected. Crying can come and go and you don't really know why. Just try to comfort your baby. Skin to skin holding does help during this time. Your baby may be resistant to soothing and may not stop crying no matter what you do, and maybe making facial expressions that look like pain. But they probably are not in pain. It could be long lasting. These crying periods could go 5 hours a day. In a total day, you could have 5 hours of these crying periods. In the evening, babies usually cry more in the late afternoon and evening. And it's just attempting to comfort your baby, but this can be all normal behavior for your child. Next slide, please. So diapers and clothing. You may be changing 6 to 12 diapers a day. After the first week, after the baby's a week old, 6 to 12 diapers is normal in a 24-hour period. So try to keep your supplies close to your changing area, so you don't want to walk away from your baby if you have them on a changing table. And once you open the diaper, the baby may pee again. So you want to tuck a new diaper, a fresh diaper, under the old diaper before you pull it off. So when you pull off the old diaper, if the baby's urinating again, you'll have the new diaper underneath to catch it. So you don't have to change linens. As we talked about before, you want to wipe from front to back. Never leave the baby unattended on a changing table. So clothing features that we usually recommend: snapping or zipping down the front, loose fitting, no ribbons or strings for the baby to get into his or her mouth. Stretchy fabric is also more comfortable. There are blankets now available that have like a little pocket that you can slide the baby in, and then Velcro straps across, which they're very convenient. In our hospital, we do give you a sleep sack to go home with. Next slide, please. So feeding your baby, if you have decide to breastfeed or chest feedings, let your doctor know and your nurse when you're a minute of your feeding plan. Try to feed your baby within 1 hour of birth. As we talked about before, that first hour is usually when the baby is very alert, and skin-to-skin holding during that time may also help the baby to go to breast as well. So once you start that first breastfeeding right after birth, that does spike your hormones to help you produce milk. And your first milk that comes in, it's down here a little further on the slide, but the first milk that comes in is the colostrum. Your colostrum, you may only see a few drops to begin with. The colostrum is can be anywhere from clear watery to thick golden like honey. It is condensed milk, so it has everything that your baby needs. Day 3 to 4 and sometimes 5, that's when the colostrum begins to change to regular milk. So that's transition milk right during that time frame. So by the end of the week, you'll have something that looks more like regular milk if you were actually seeing it. Proper latch is very important. You want to make sure your baby has a nice deep latch so the baby can pull the milk out of the breast. So it should feel a little bit like a pull or a tug. It should never feel like pinching or clamping. And if that does, that could lead to nipple soreness. There should be no pain associated with breastfeeding. If there is, please ask for help. So a painful latch is an improper latch. So your nurses should be able to help you achieve a deeper latch. Also, if you have a lactation consultant available to you, I'm also a lactation consultant, so I see patients that have issues like this as well. Feed your baby on demand at least 8 times in a 24-hour period. So you want to offer the breast 8 or more times, being with the baby once when the baby's showing feeding cues. Sucking the air, putting their hands up, kind of rooting at the hands, they are all feeding cues. The APA recommends exclusive breast or chest feeding for the first 6 months, and then you would add additional foods, and they also recommend continuing with breast milk until 1 year of age. just try to relax and get to know your baby. With breastfeeding, it's knowing what works, getting to know what works best for you and your baby, different positionings and different, the way you latch your baby, the way you lay back with your baby. You'll get to learn what your baby likes and what works for both of you. Next slide. So if you choose to feed your baby formula, in the first week, they will be taking like 1 to 2 ounces per feeding. By the end of the first month, we're up to like 3 to 4 ounces every 3 to 4 hours. The first week or so, the baby may be wanting to feed every 3 to 4 hours. So again, it's a minimum of 8 feedings in a 24-hour period. By 6 months, 6 to 8 ounces at each feeding, 4 to 5 times a day is normal. There's different types of formula, and it depends. Typically, it depends on what formula your hospital has available. That's what they will give to you. Each hospital has to buy their own formula, so they are. Each hospital has typically one type of formula, unless your baby would need a special formula. If you're using the powdered formula, you want to, at home, you want to make sure you're using boiled water. So it becomes sterile for the formula prep. Follow the instructions. You don't want to add extra water. Adding extra water to maybe stretch the formula to make it last longer actually cuts back on the nutrients. Any prepared formula that, if it's in a bottle that the baby already has put their mouth on, that's only good 1 to 2 hours. You can refrigerate it for 24 hours if you have an open bottle. Next slide, please. Okay, we'll talk a little bit about safe sleep. We no longer recommend the baby laying on their bellies. There's no evidence that that makes a difference as far as the baby choking. I know that was what they used to think, laying the baby on their belly. So the ABCs of safe sleep is the baby should be sleeping alone in the crib by themselves, lying on their back. So it's alone back in their own crib, not co-sleeping. So no blankets, bumper pads, or toys should be around the baby. No sharing. You can share a room, of course, but no bed sharing. Make sure there's no stuffed animals or anything that the baby's face can get pushed into and the baby can't get away from, like bumper pads, and again, stuffed animals, blankets, pillows. Make sure the mattress is the mattress for the crib that you're using, so it's snug up against the panels of the crib, and that the linens that you're using are the ones to fit that particular one as well. There is sleep guidelines on YouTube from the American Academy of Pediatrics, as listed here. Next slide, please. So milestones, there is a milestone tracker from the CDC, a milestone tracker app from the CDC that will give you more in depth of what you should be looking for. It goes over like social and emotional milestones, language development, cognitive learning, thinking, problem solving, and skills, physical development. And so it's really nice app to be able to record things as well. So help your child grow and thrive with the CDC's free app. Next slide. Oh, any questions?
Thank you so much, Donna, for sharing. I think we do have a couple questions in the Q&A in the chat. So if you want to look at those and answer them via text, we're running a little low on time. So I think we're going to go ahead and move to the next presenter, if that's cool with you.
Okay. Thank you.
All right. Perfect. Okay. So next we have a presentation from Florida Safe Kids. Are you ready to go?
I am ready.
Perfect. Thank you so much.
You're welcome. I'll try to just hit the highlighted areas so that we can save a little bit of time. So if you want to go to the next slide. So first of all, my name is Rhonda Sorelli. I am the Safe Kids Treasure Coast Program Director, but I'm going to present on Safe Kids Florida so that you know the resources that are out there. Safe Kids, paraphrasing this slide, is an unintentional injury prevention program for children 0 to 19. There's over 500 coalitions in the United States, and we are in 25 countries. And Safe Kids has been around for about 30 years. And, we know that unintentional injuries, which is the #1 cause of death for children in the United States, is 100% preventable. And so our mission as a Safe Kids Coalition is to reduce and eliminate those unintentional injuries and deaths to children. Next slide. So basically, a coalition coordinator's job is to build a broad-based structured community program whose mission is to reduce the unintentional injuries through a multifaceted strategic public awareness, education policy, and community actions. So in our coalitions, we have all of our first responders, law enforcement, firefighters, hospitals, our local children's services councils, school districts, pediatricians, OBGYNs, whomever that we're dealing with, or whoever in the community who's working with children, Boys and Girls Club, YMCA, participate in the coalition so that we can all work on one concerted effort to reduce those injuries and fatalities. Next slide. So how do we do that? We do that through programming. I can speak directly to my coalition and what we work on. Each coalition is a little different throughout the state of Florida. So at the end of this presentation, I do have a map so you could see if your area has a Safe Kids Coalition. But under home safety, we address falls. As far as children, when we're discussing falls, a lot of that comes into playgrounds. Your babies are a little young for that. So if you're living in, a multi-story home, you want to make sure that you have baby gates at both the top and the bottom of your stairs. If you have a crib in the upstairs bedroom, you want to make sure that you're keeping it away from a window because you don't want them near the blinds or the blind cords. But if you've secured that and you're going to open the windows on the nice cool days, we're in South Florida, we don't have too many of those. You want to buy a window guard so that the baby can't push the screen out of that window and risk that fall. We have button batteries. Button batteries is becoming, injuries are becoming more and more prevalent. Button batteries are everywhere. They're in your key fobs, your remote controls, greeting cards, books, that children are using. And so the danger is that they're tiny and they're small and children are swallowing them. And if you think about a battery, it's creating an electrical charge. Now it's meeting moisture and it actually causes damage to the esophagus, the stomach, the intestines. So you want to make sure that when your children are small and you're putting away those remote controls, you're taking your key fobs, don't put them in your diaper bag because, children will find their way into the diaper bag. Put those keys up where they can't gain access. As far as water safety, all of the coalitions do provide water safety education. So when you're talking about, babies in the home and toddlers, one of the things that, you need to make sure that you're doing is, keep the toilet lids closed. If you have can get a toilet lock, put that on there. Babies are head heavy. So you may not realize that that's a place that they can drown, but it absolutely is. Don't leave your tubs. We're in Florida, so we have hurricane season. If you're going to fill your tub because there's a storm approaching, make sure you're closing and locking the bathroom door. Again, we're in the middle of an emergency and you don't want to combine that with a tragedy because you've left that door unlocked. Mop buckets. So if you have a mop bucket, again, they're head heavy. So you want to make sure that you've emptied it right away because you don't want them tipping into the water. If you have backyard pools, you want to make sure that you're putting, door alarms on and leaving them on and not turning them off. So if the child goes outside, that alarm goes off and you're aware. Same thing if you're living somewhere where there's a lake or a retention pond. We're seeing an increase in drowning there. So you just want to make sure that you're aware of where your water sources in the home are and that you're securing them. We cover fire, burns, and scalds. As far as your babies, you want to make sure that you're testing that water in the tub. Don't use your hand because as parents, we're used to sticking our hands in a hot sink. So it's not a good gauge. They sell the little ducks that, will turn red if it's too hot, or you can use your elbow or the inside of your wrist. With our scalds and burns as well, don't hold your baby while you're cooking. If you have to tend to them while you're cooking, then, take the food off the heat and go tend to them. Take the pot handles and turn them inward. Don't leave them hanging so that a toddler could reach up and grab and pull it down on top of them. If you're eating or drinking something that's hot, you don't necessarily want to be holding the baby so that, you're drinking a cup of coffee, they kick it and it splashes on them because they're so sensitive that it is going to burn. We do a lot of education on furniture TV tip overs, which is, tethering that furniture to the wall. If you don't have it tethered, then, don't put toys or sippy cups or something that will entice the child to climb on top of that piece of furniture, because, we unfortunately have a significant number of injuries with furniture and TVs tipping over. Toy safety, you want to make sure that the toys are age appropriate for your child, so read the labeling on the toys. Holidays, 4th of July, we do a lot of education. We send out on fireworks. Right now around Christmas, we'll provide a lot of education on Christmas lights, your lights hanging outside, the Christmas tree, tipping the Christmas tree over, deep frying turkeys, that kind of thing. Medication safety, we have a wonderful scholastics curriculum that we not only use with parents, but we also use it teaching our 5th and 6th graders medication safety. For the new moms, we discuss with them proper dosing. A teaspoon out of your kitchen drawer is not a teaspoon of medication. If you measure them using a proper dosing utensil as opposed to a teaspoon, you will see that you've either over or under medicated. If it is a prescription from your provider, you want to make sure that you're following that label. We see a lot of kids in the ER for unintentional over-the-counter or prescription medication overdoses because parents aren't following the labels, meaning that, if you're on a Z-Pack, you double dose on day 1. So we've had some parents think that then they should double dose with amoxicillin or Omnicef. And what you're doing is you're over medicating them because they're 2 different types of antibiotics structured to work 2 different ways. So you want to make sure that you're following all recommendations and labels on the medication. Safe Sleep, Safe Kids, My Coalition, we support the efforts of all of our maternal child health programs. So we don't typically do a lot of safe sleep education out in the community because we defer that to our Healthy Starts, our Healthy Moms, Healthy Babies. But if they require or request any information, we'll definitely come in and help them. Next slide. So we have sports and play safety. Again, not necessarily following into your little ones. My program, we go into the public schools and we do bike rodeos and we do pedestrian safety. So we teach bike safety, pedestrian safety in the schools and, providing them skills on, stopping and starting, that their bicycle is considered a motor vehicle. They need to follow the appropriate traffic laws. We do playground safety with them to reduce the numbers of falls. And then we cover sports safety, which is emergency response, overuse injuries, dehydration, and concussion prevention. Again, those don't necessarily relate to your babies, but those are other programs that we can provide education on. Next slide. So then we have our car and road, again, where we're addressing bicycle safety, pedestrian safety, teen driving. We use a program here called Impact Teen Drivers. we do heat stroke awareness. So that's leaving your children in hot cars. So to add to that, it's not just hot cars anymore. A lot of our cars now are push to start, right? So all a key fob has to do is be in the car. So when you're pulling into a gas station and you get out and leave that key fob in the car, and your children are in the car, that's an increased risk if somebody wanted to carjack you and take your car with the baby in the back because you've left the key fob in. So we recommend, one, to prevent your child from getting locked in a hot car, that you're taking those key fobs out because they could malfunction. It's all working on a sensor. And also to prevent anyone from jumping in your car and taking off with your car with the child in the back. If you have the key fob out and in your pocket, then that's not going to happen. But you want to make sure that not even for a second that you're leaving your child in a car. If you're getting out of the car, bring your child with you. And we do know that only 12% of children who suffer from heat stroke from being left in a car are actually left intentional. The other 88%, it was change of routine. So, some things that you can do to prevent that, put your shoes in the back seat where the baby is, put the diaper bag, put your purse, put something in the back that you need to leave. I have to teach a course later tonight on child passenger safety. And my recommendation is to put their cell phone in the back because there's nobody that will be in their office or in a location for longer than 5 or 10 minutes before they realize their phone's gone. So your cell phone is one of those good things just to sit in the back seat. We do spot the tot. So spot the tot is a rug that we set up and we put behind a vehicle. And then we have the parents sit in the driver's seat and use their side mirrors and their rear view mirrors. And it's 19 feet and we continually move their children back and see how long it takes them to be able to view them, even with backup cameras. And so we're just teaching them about backovers and frontovers, accidentally backing over your child or accidentally running over them. And I will tell you that all of the coalitions in the areas have child passenger safety programs. So that's car seat programs. They all may run a little differently than my particular runs here, but we can provide low cost car seats. They're brand new. They're convertible car seats to our St. Lucie County, Martin County residents for $25. It's like I said, convertible. It's 5 pounds to 65 pounds. It's a car seat that's going to last you from birth until they're toddlers. So, if you're a family who, can't go out and afford $100 car seat, this is the perfect program. They all run a little differently. We have 3 car seat fitting stations a month that we provide these services. So if you're interested, if you have a car seat and you just need to have it inspected, again, you can call your coalitions and they will schedule a time for you to come in and have your car seat inspected. 75% of all car seats are installed incorrectly. Now, that's either the car seat itself is not installed properly in the vehicle or the child is not riding properly in that car seat. So you want to make it a priority to get that checked to make sure that it's in right, because you want to keep your child safe. And as far as safe sleep, what I will bring up to you is that your infant carrier, if you have an infant carrier, that is not a safe sleep environment. Okay. That is designed for them to ride in. It's not designed for them to sleep in. When you have a infant carrier properly installed in the back of your car, it is leveled correctly at that 30 to 45 degree angle. Once you take that infant seat out of the base and you sit it somewhere else, we don't know if it's sitting in there correctly. And, unfortunately, we've lost babies recently because they were left at a daycare and the daycare used that infant carrier as a safe sleep environment. And where we see it happening is that it's being left as a safe sleep environment for the child. And most people don't keep them restrained in the 5-point harness because they don't look comfortable. So they take them out, which allows them to scoot in the car seat, and they're head heavy. So their head slumps over and their airways cut off. So it's safe for them to ride as long as the car seat's in that proper angle, that 30 to 45 degree angle, but it is not safe to leave with a babysitter or a family member as a safe sleep environment. Next slide. All right, so this is going to be where we have coalitions coverage areas. So the slide after this will give you the contact information, but you can see anywhere that there's a color other than white. except for Indian River and Okeechobee should be blue because they're under myself as well. So if you live in Martin, St. Lucie, Indian River, Okeechobee, those are my county coverage areas. So if you were to reach out into any of the surrounding colors, those coalitions could help you with any of the education that we've discussed. And like I said, I'm trying to kind of go through this quickly so we can get our other presenters. And the next slide. And I know it's pretty small, but these are your coalition coordinators and their phone numbers where you would be able to contact and reach them with any questions. And I did see a couple of questions load up. One of them, somebody asked if fire stations do inspections. So not all fire stations do inspections. Here in St. Lucie County, we do have roughly 20 firefighters who are certified as technicians. However, they will not do a inspection or an install without a Safe Kid staff person present. That's just how that partnership is set up. We also have the Port St. Lucie Police Department that we partner with in Cleveland Clinic. So your best bet is to call one of those coalition coordinators and find out where they're actually doing their inspection stations. So were there any other questions that I missed?
I don't believe so. Yeah, go ahead and take a look at the chat and Q&A just in case, but I think we're doing pretty good. Thank you so much for sharing all
You're
of this great
welcome.
information.
I'm sorry, I tried to go through so quickly, but I wanted to make up a little bit of time.
No, we appreciate your
Same way where you can
timeliness.
purchase the duck from, you can get them at Walmart, Amazon, Target. They pretty well sell them anywhere over in your baby section.
Yes. Good question. All right, we're going to go ahead and hop into some warning signs for postpartum mood and mental health disorders with Dr. Lopez. Are you ready to go?
There was one more question that popped up. I'm sorry.
Oh.
I don't know where you are, Catherine, that your car seat, your health department has a car seat program. I think there's only myself and 2 other health departments that have a car seat program, but they should all still be working the same.
All right, perfect.
Hi, Chris.
Yes.
This was Hannah. I was wondering if WIC is next or
We've got a quick section on postpartum and then we have WIC. Do you have a hard deadline of when you need to leave today? Because we could skip to WIC if we need to.
if possible, I was going to switch to another call at 2, but I'm pushing it back just a little bit, if that's okay.
Okay, perfect. Yeah, I can go ahead. Dr. Lopez, are you okay with swapping times with WIC?
Yeah, no problem.
Okay, thank you so
Appreciate that
much.
so much.
Okay, we'll jump forward here. Okay, I think we're ready.
Thank you guys so much. Juggling my calls here. My name is Hannah Barnes, and I'm a dietitian. I work as a public health nutritionist for the Florida WIC program in Tallahassee, Florida. Today, I have the pleasure of sharing with you all on the topic of something that WIC is very familiar with, and that is food and babies. I'm going to be going over a lot of information in a very short period of time. But if you are interested in learning more or reading more on this topic, I'll share our website where you can download several pamphlets and handouts on the same information that I'm going to share today. Okay, we'll go to the next slide. All right, so I'm going to start off by introducing the Florida WIC program and then the services that we provide, as well as go over what qualifies a person or a household for WIC services. In the second half of my talk, I'll be discussing infant feeding guidelines and ways parents and caretakers can be confident in their ability to give their baby what he or she needs when they're growing and developing, as well as know how and when to introduce appropriate foods as baby gets older. And then I'm going to end our talk today going over several ways that you can reach out to your local WIC office to apply for services. And then if you all have any questions, I can answer them. Okay, next slide. I'm sure that you all are pretty familiar with WIC, but for those of you who are not, it's also known as, WIC is also known as a special supplemental nutrition program for women, infant, and children. And it's a program designed to support the client's health by positively impacting both their nutrition and health behaviors for a lifetime. And in Florida, we have over 210 clinic sites in all 67 counties, which are conveniently located, often with a county health department. Services that we do provide to our participants includes nutritious foods, such as milk, egg, cheese, yogurt, whole grains, fruits, vegetables, as well as age-appropriate infant foods. In addition to healthy foods, we also provide individualized and tailored nutrition counseling and education specific to their nutrition needs and medical needs, breastfeeding support and education from trained lactation staff are also available to breastfeeding women. And we also do have peer support after normal clinic hours. So clients can call for breastfeeding support up until later in the evening. And then we also help coordinate referrals to health and social services, as well as immunization screenings with local health departments and providers in the community. All right, next slide. To apply for WIC, you must be a woman who is either pregnant, has had a baby up to 6 months ago, or is breastfeeding until baby's first birthday. Any children in the household are categorically eligible for WIC until their their 5th birthday. And all participants must be living in Florida. However, there is no residency time requirements. To be determined income eligible, your household size is compared to your annual gross household income, which can be broken down into monthly, biweekly, weekly pay, whatever pay information that you have available as documentation. And if that amount is less than what's listed for the annual amount limit for your household size, you are determined income eligible. Anyone who applies who is already receiving food stamps or SNAP benefits, Medicaid, cash assistance, they're all automatically qualified for WIC, and there's no requirement to show any income proof. And we also strongly encourage any foster parents, guardians, single fathers who have custody of WIC eligible children to apply for WIC as well. All right, next slide. All right, so for the second half of this presentation, I'm going to go over some infant feeding guidelines starting at birth through 12 months of age. First and foremost, we want to encourage all women who can breastfeed to breastfeed exclusively until 6 months, introducing complementary foods at this time, and continuing to breastfeed until baby reaches 2 years of age or beyond, if mutually desired by both mom and child. This recommendation comes from the American Association for Pediatricians for the best preventative pediatric health outcomes. There's no limit to the number of recommended breastfeeding sessions per day, but we do want to be mindful to aim to latch baby on to nurse a minimum of 8 to 12 times per day at whatever length that baby chooses to nurse for, especially within the first 2 months of life. And they often sleep for long periods of time. So we want to make sure that we get in a minimum number of those 8 to 12 feedings within those first 2 months. And then 7 to 8 times following for the 4 to 6 months. And by that time, once they've reached 6 months old, they're starting the complementary feedings and additional foods. For infants that cannot be breastfed or breastfed exclusively, they'll receive formula. And due to the size of their small tummies, we want to make sure that we provide them 2 to 3 ounces max per feeding between 0 to 1 or 0 to 2 months, anywhere between 8 to 12 times per day. And it's important to note that we do have established recommended ranges for fluid for the number of fluid ounces per feeding for formula-fed infants based on their age, because it's very easy to overfeed an infant when they're drinking from a bottle. So it's recommended not to prepare more than the amount of fluid ounces that the infant's stomach can handle at one feeding, and then to always consistently hold that baby bottle versus propping it up against a carrier or an arm, and then giving breaks and pauses to allow the baby to determine their fullness so they can stop stop drinking from the bottle when they do have that sense of fullness. For infants that are 2 to 4 months of age, anywhere between that 4 to 6 fluid ounce bottle is appropriate, around 6 to 8 times a day, and then 5 to 8 ounces anywhere between the 4 to 6 month ages, and 5 to 6 times per day. And then by the time a formula-fed infant reaches 5 months old, they're starting to eat their very first solids, as opposed to exclusively breastfed infants waiting until about that 6-month mark. And it's also important to note that water is definitely not recommended to be given to any infants under the age of 6 months due to the risk of water intoxication, toxicity by overhydrating their bodies, which can happen really quickly. That overhydration leads to electrolyte balances, which can be extremely serious and maybe fatal in some cases. So all of the adequate hydration comes from properly prepared infant formula or mom's breast milk. All right, go to the next slide. Okay, so I want to go over some information that you'll take into consideration when you're preparing to introduce solids for the first time to your baby once they've reached 6 months of age. Typically, baby cereal mix or a single brand such as oatmeal or barley will be baby's first solid food. That dry cereal may be mixed with water, formula, expressed breast milk for additional nutritional value. Baby cereal is not meant to be added to the infant bottle. This can lead to overfeeding and again, stretching of the infant's stomach prematurely, but instead be given to a baby with a spoon and prepared to the consistency of prima wheat. And then this method allows baby to determine their fullness again and pause or stop eating altogether once they've determined that they've eaten enough. We also want to point out that rice cereal should not be the only type of baby cereal or baby food given to baby. This recommendation comes by the Food and Drug Administration, so FDA, and that's because rice naturally contains arsenic, and so we don't want them to consume too much because of the size of their bodies are very small for that arsenic to build up. So choosing options like oatmeal or barley, whole wheat are all available as alternatives to kind of break up that monotony of just sticking with the rice cereal. When introducing foods at this stage, you want to make sure to introduce all new foods by themselves. So buying single variety fruit and vegetable baby foods and giving baby anywhere between 3 to 5 days to be observed, having this food by themselves. So if you notice any reactions, you can pinpoint what that reaction was caused by. Foods that are more likely to cause an allergic reaction are cow's milk products, eggs, fish, shellfish, tree nuts, peanuts, wheat, soy, and sesame. For many babies, these foods can be offered within the first year. For the first time, yogurt and cheese is often given before age 1, but we do want to wait until age 1 before giving any type of cow's milk or soy beverages due to the increased risk of developing an allergy or intolerance. And it's also recommended that peanut butter or nut butters are given only to baby when they're diluted or spread very thin on other foods mixed in with yogurt or baby cereal, just because they can be a choking hazard if they're given and still in big chunks or globs, and babies can't break down or melt that peanut butter in their mouth sufficiently. And of course, we don't want to feed baby any nuts, and definitely consult with your doctor if that makes you feel a little bit more comfortable before introducing any of these allergy prone foods. And then if your baby does well with these new foods, excuse me, continue to give them, as well as mixing in with any of your pureed vegetables, fruits, beans, and also baby meats, and making sure that your fish, shellfish, and eggs are cooked well. We'll go to the next slide. So at WIC, we often get the question about how much of this variety or that variety of food does my baby need? And this is going to be varied based on the individual baby as well as change over time. However, we do have general guidelines for offering different food groups between the months of 6 and 8-month stage, which I have on the screen. I won't read out to you. But I also wanted to start off by pointing out that WIC does provide baby cereal, single pureed fruits and vegetables to all infants starting at 6 months. For the exclusively breastfed infants, they will receive the additional baby meats in their food package. All of these foods can be mixed together to create mixed dinners and also expand your baby's palate once they've been all tested out by themselves and tolerated well by baby. And then at this point, water may be given, but you may want to consult with your healthcare provider in terms of the specific amount that your baby would receive in water, but it's typically anywhere between 4 to 8 fluid ounces per day, but no more than that. We'll go to the next slide. All right. In the 8 to 12 month stage, as you can see, both the variety and portion sizes are steadily increasing. It's important to take into consideration that at this stage, babies are exploring textures, experiencing foods not just by taste. So it would be appropriate to introduce soft cooked foods to give them a variety of textures and consistencies to experience, as well as giving them something to hold with their hands. So a soft cooked noodle or soft cooked rice, something that they can gum. Thinly sliced cheese is really popular at this stage. So in addition to new textures, we have grains that are added to their diet. That can be whole grain toast, or soft cooked rice that they can pick up in their fist and feed themselves with. This is a great source of dietary fiber as well to help with, dietary fiber helps baby with waste elimination and also fullness and vitamins. And then yogurt's really a popular addition at this stage. There's many beneficial reasons why adding yogurt to your baby's diet is a good idea. It's a great source of calcium. It also has probiotic benefits to improve digestion and aid in any issues with constipation or irregularity in their bowel movements. We do want to note that quite a few yogurts are sweetened, so they have a lot of added sugar to them, which doesn't have much benefit to baby. And we want to make sure that their palate doesn't get used to over-sweetened foods too soon. So we suggest sticking with a plain yogurt and then adding any fruit purees or any soft pieces of fruit that have been very finely diced to sweeten that yogurt with. All right, go to the next slide. Okay. So lastly, we have some additional guidelines to keep in mind when you're adding new food textures and variety at the 8 to 12 month baby stage of their diet, just to make sure that everything is presented in a manageable consistency and size for your baby's safety. We want to make sure that all foods, hard foods, are cooked to a soft texture, mashable, something that can be squished between the fingers without a lot of effort. And we make sure to avoid cutting foods into circular shapes so that they can't block airways. And that if we are giving any type of tough meat like beef, that we're making sure that it's ground finely. Cheeses are great at this stage, but they need to be sliced thin so that they dissolve in the mouth. Obviously, any fruit needs to be diced. And then again, thinking about the skin on grapes can easily clog up baby's throat because we don't necessarily catch them in our teeth to chew and break apart very easily. And then of course, making sure that there's no remaining seeds or anything like that that would not be edible or soft for baby to chew. And at this stage, the dangers of choking hazards from foods increases. So we want to be sure to avoid some foods altogether. Even if you are sitting there with them, I think I've heard a lot of times, I'm sitting there with them, I'm watching them eat the popcorn, I'm watching them eat the chips and making sure that it's going down okay. But sometimes that's not good enough. And sometimes we can't intervene adequately. Even if we are watching them eat, they still may choke on these foods. So just avoiding them altogether. They're considered choking hazards until age 4. Those most common choking hazards includes chips, popcorn, pretzels, nuts of any kind. Any thick nut butters that haven't been smeared very thinly or mixed in with something, hard cookies, granolas, dried fruit, raw vegetables. So foods that we consider very healthy can be very dangerous and risky to be given to an infant at this stage. And hot dogs. Hot dogs very popular, but they are inherently round. And we must make sure if we are giving hot dogs, on the rare few occasions that we do give hot dogs, that we are cutting it into pieces that are, resembling ground meat. And at 1 year of age, it is appropriate to introduce that cow's milk as an option, but it should not be provided in the place of infant formula. So sometimes we see those infant formula bottles, they've been swapped out for almost an equal amount of whole milk at age 1. And we don't really want to see that happen because it displaces baby's appetite for those whole foods and getting other nutrition, vitamins and minerals from other diet, as well as, contributing to issues with constipation and also promoting very selective eating at that stage when their palate is really ready to grow and to experience a variety of foods at this stage. And then finally, we want to encourage the transition to the use of a sippy cup or even a regular cup when seated and drinking beverages at meal times versus continuing on, using a bottle until 14 and 15 months. Or even using a sippy cup absolutely 100% of the time. If they're sitting down and they're holding things in their hand, then we want to encourage them to be holding baby utensils and practicing as soon as possible and holding regular cups and putting regular cups to their mouth and drinking from them. Okay, we'll go to the last slide. All right, so if you are interested in applying for WIC and you have not yet, encourage you to do so as soon as possible. We love meeting our prenatal clients as early as possible in their pregnancy to give them as much information as we can. And you can find a list of our local agencies in Florida by visiting www.floridawic.org. You can also call this 1-800 number that we have on the screen. But if you have any questions about the information in the presentation and I can answer them for you, you can call our number that's also on the screen. I have a picture of a phone because one of our biggest improvements or expansions of the program is now having a mobile app, which makes finding WIC foods so much easier, knowing where you can find a WIC store or when your appointment is. It's all there on your phone now. So yeah, that's everything that I had to share today. Thank you all so much for this time.
Awesome. Thank you so much, Hannah. And thank you to everyone who decided to stick around for these presentations. We know we went a little bit over today. I'm just going to cover the very the most vital parts of warning signs for postpartum mood and anxiety disorders really quickly, and then we'll talk about what you should expect as far as the prize giveaways that were advertised as part of this event. So really one of the main perinatal mental health disorders that might come up are postpartum depression, anxiety. You can have post-traumatic stress disorder, bipolar, or postpartum psychosis. The most common ones are going to be postpartum depression or anxiety probably. They will screen you in the hospital, and it's good to answer those screenings truthfully, to kind of see if you're having some of those negative feelings, and they'll probably ask you about it in your follow-up appointment as well, when you go see your OB or midwife after giving birth. The most important things to know are that you're not alone if you're feeling overly anxious, overly distressed, overly sad, or if your family members are picking up that something's wrong. Definitely ask for help, because there's no shame in doing that. And postpartum can look like a lot of different things. It's not always going to be wanting to hurt your baby or hurt yourself. It could be freaking out because your baby didn't eat exactly 15 minutes on each side and you're worried that they're going to starve. Things like that crop up can be warning signs that maybe not everything is all right up there. And there are things that health professionals can offer you to help with those symptoms. All right, so I'm going to skip forward again to our ending information here. So we're so grateful that you joined us today. Again, sorry that we went over, but the main things you need to know as far as prize giveaways, we will be giving away 2 pack and plays as well as a couple of Panera gift cards. So keep an eye on your email. We'll be sending out a post-webinar email with all of the slides, the recordings, and a bunch of helpful information from our presenters today. And you'll see that within the next week. And you'll also receive an email from a healthybirthday.org email account that will let you know if you've won a prize. If you don't receive an email from us, unfortunately, you probably didn't win a prize. I would keep an eye on your email just in the next couple of weeks, because we'll offer them to the first round of people. And if we don't receive responses, then we may send them out to another group of people. We do require that you verify your email address or mailing address, just to make sure that all of the information is correct before those prizes go out. And I believe that's everything. We're so grateful that you hopped on today and that you spent time with us, a little bit extra time with us. And we're so thankful to all of our amazing presenters that joined us on the call. Megan, do you have anything to add before we leave today?
Just congratulations, everybody, and thanks to the Florida Department of Health for this opportunity. And we're so excited that we could be part of your journey. And thank you to our presenters. It was great. It's a lot of great information. So thank you so much.
Yes, thank you so much, everyone, and have a great rest of your day.
Thank you.